All right, so we are continuing with our talk today under the Mind Your Brain series. This is a joint program brought to you by the Faculty of Medicine and Health Sciences, Faculty of Science, as well as the Malaysian Mental Literacy Movement. And we thank the CCCD also so much for bringing us this series of talk to us today. And I'm Dr. Nadia. I would say that I am the resident psychologist here at the Faculty of Medicine and Health Sciences. And today we are very, very honored to have with us Dr. Tong Kai Shin, a clinical associate professor at the Department of Population Medicine. Dr. Tong Kai Shin is a consultant psychiatrist who is very, very dedicated and committed towards providing care to those with emotional needs as well as mental health issues. So she's going to be talking about the broken brain, stress and anxiety awareness, something that has been plaguing us for a long time, particularly pandemic and post-pandemic. So I think it is very, very relevant to all of us. And I'm sure we're very excited to hear the talk from Dr. Tong Kai Shin, but a few housekeeping rules before we begin. If you have any questions, kindly type them in the chat box and they will be addressed at the end of the webinar. And also for YouTube participants, please don't forget to also sign in your attendance with the link provided in the chat box. So I think without any further ado, I would like to invite Dr. Tong Kai Shin to share with us her valuable insight. Dr. Tong, the floor is yours.
Okay, thank you, Dr. Nadia, for the introduction. So good afternoon, everyone. Okay, I'm actually going to talk about depression in elderly population, yeah? All right, but however, if anyone is interested to know more about stress and anxiety, I'm sure we can have a future webinar about it, okay? All right, so, so this is what I'm going to touch about. Some basic knowledge on depression in elderly population, the treatment options available for depression, and also how we can be empathetic and supportive to people with the illness. Sadness, okay, feeling sad and having depression, it's not the same, all right? Feeling sad, it's the feeling of sorrow or unhappiness. It is normal for people to feel sad, okay? It is a psychological response to unfavorable situations. Now, sadness and depression have similar reactions, but like I said, they are different. Sadness doesn't last very long. Okay, it can be something that makes you sad that day, and then you eventually get over it. Okay, depression is different from the usual mood fluctuations, and they are usually short-lived emotional responses to the challenges in everyday life. Depression, however, lasts longer than sadness. It affects someone's mood and causes them to feel drained and causes someone to feel down for weeks or months. Now, depression is something that can happen to anybody. Okay, remember that having depression is not a sign of weakness. It can begin suddenly, possibly triggered by a crisis or stressful change. Now, depression interferes with normal functioning, okay, and it can continue for months or years. Okay, depression is a common mental illness. Okay, as you all know, globally, okay, more than 300 million people of all ages suffer from depression. And the American Psychiatric Association actually estimates about up to 5% of those aged 65 and older suffer from depression. Many researchers, even I, believe that this percentage is actually can be higher because many who have depression may often be missed or misdiagnosed. Now, the diagnosis of depression in the elderly are often missed because symptoms of medical illness may be similar to depression. For example, being fatigued, having loss of appetite, or loss of interest. Some are not diagnosed at all because older persons are less likely to recognize depression. There are also people who accept the symptoms of depression as part of the aging process. There are some are not diagnosed because of resistance to the idea of emotional illness or feeling embarrassed by the stigma of mental illness. And they may also doubt the benefit of seeking help. Now, older people are raised in an area where people don't talk so much about their feelings, all right? And they have this idea that people with emotional problems are perceived as having character flaw. Remember, depression is not a normal part of aging, and healthy functioning older adults are at no greater risk for depression than younger adults. Okay, let's look into symptoms of depression. First of all, you must have feeling of intense sadness, okay, to say or identify depression. Okay, you may also have loss of interest in things you used to enjoy. For example, going out for a walk, okay, or having a meal time with your friends, all right? Okay, or even some of your hobbies like gardening or watching TV drama, all right? They may have loss of interest, like I said, loss of concentration and focus, all right? Feeling fatigue, I'm sorry. Feeling fatigue, okay, more tired easily, all right? Or having psychomotor retardation. Okay, example will be, you feel like your thinking and also your action, your movement are actually slower. Okay, unable to sleep or sleep more than usual is also one symptom of depression. Feeling guilty, feeling worthless, all right, other symptoms of depression. Loss of appetite or eating more than usual can be symptoms of depression. Feeling agitated or more irritable, or having suicidal thoughts in those people with severe depression. All right. Now, there is a simple screening tool that we can use to screen for depression in the elderly. All right. It is what we call the geriatric depression scale. Very simple two-item scale. You can ask, have you often been bothered by feeling down, depressed, or hopeless? That's question one. Question two, have you often been bothered by having little interest or pleasure in doing things? So this is the second question. Now, if you get yes to either one of it, it is considered positive. Positive for the screening for depression. So this tool, even though simple, is highly sensitive for detecting depression in people over the age of 65. Now, if you have one of the yes for one of the question, please go and have a formal assessment then. Yeah. Now we look into types of depressive disorders. Generally, it is easier if we put it into mild episode of depression, moderate episode of depression, or severe episode of depression. Now, in severe episode of depression, okay, they can have psychotic features such as hallucinations or delusions. Okay, what causes depression? Depression is the result of a complex interaction of biological, social, and psychological factors. Now, these 2 points here, okay, is the biological factors that can lead to depression. Okay, having family members who have depression may increase a person's risk by 2 to 3 times compared to an average person. Okay, or deficiencies of certain chemicals, for example, monoamines such as serotonin in the brain may lead to depression. What I want to point out here is that even though if let's say you have a family members with depression, it is not 100% certain that you will have depression. It is just going to increase your risk of having depression during stressful period. Now, people who have gone through adverse life events such as unemployment, bereavement, or psychological trauma are also more likely to develop depression. All right. And then this depression in turn will lead to more stress and dysfunction and worsen the affected person's life situation and depression itself. So it's a vicious cycle. Now we look into risk factors for depression in elderly. Now, in elderly age group, all right, you may have multiple medical illnesses. All right, all these are risk factors for depression. Okay, you may also have or experience multiple losses. For example, you lose your jobs, you lose your health, you lose some of your abilities, all right, your friends, money or hopes. Okay, any kind of decrease in quality of lifestyle, okay, at the age of, elderly age, okay, can increase your risk of getting depression. Lack of social contact, all right, cognitive dysfunction, all right, for example, memory deterioration, okay, or previous history of depression. It's risk factors for depression. Okay, suicide. At its most severe, depression can lead to suicide. Okay, about 15% of depressed patients committed suicide, and 80% of them consulted physician in the month before death. So that is why we need to pay attention to those who expresses thoughts of taking their own lives seriously. All right, and elderly are less likely to have had previous attempt or to complain of suicidal thoughts. Now, this means that they are more likely to complete it at the first attempt. Okay, here are the risk factors for suicide. All right, as you can see, older age group is one of the risk factors here. Okay, having depression is the risk factor for suicide. Okay, multiple comorbid physical or medical illnesses. All right, male gender. All right, they are likely to complete the suicide attempt. All right, living alone, poor social support. Okay, abusing illicit substance, or past personal or family history of suicide. All these are the risk factors for suicide. Now we move on to treatment for depression. Okay, depression is a disorder that can be reliably diagnosed and treatable. Now I mentioned about a screening tool just now, all right? It is the most simple screening tool for depression, all right? But there are other screening tools as well available. For example, the DAS, okay, the Back Depression Inventory. Okay, and finally, actually, it is diagnosed clinically by a clinician. Now, there are effective treatments for depression. Okay, don't be afraid if you suspect yourself or being diagnosed with depression. Now, what we need to worry or concern is of that untreated depression. It's not good. It can delay recovery and worsen the outcome, not just on the mental health or illnesses, but also the medical illnesses. Now, it can cause increased use of healthcare services, poorer health outcomes, including access, disability, or mortality. I'm happy to say that treatment is effective in about 80% of cases. Now, when mild, people may be treated without medication. Okay, when I say without medication, meaning they can opt for psychological intervention, right? But when depression is at least moderate or severe, they need medication most of the time and professional help. Now, depression can be treated by non-specialists as well as part of the primary healthcare, right? Meaning you can go to your nearest clinic, okay, to see the general practitioner, okay, to get you treated for depression, right? They will refer you out for specialist care if they think they couldn't manage it further, right? Specialist care is needed for individuals with complicated depression or those who do not respond to first-line treatments. Now, effective treatment for depression requires multimodal approach. Now, this multi-modal meaning combining pharmacological intervention with psychological or psychosocial interventions. All right. Now, it also includes treat comorbid conditions, all right, comorbid medical conditions, or other causes of secondary depression. Okay, like for example, thyroid diseases can lead to mood disorders such as depression as well. So we must remember to treat possible comorbid or causes of depression. Okay, these medical causes of depression. Now, and then we will look into choosing the appropriate level of care, either using medication or therapy. Okay, now treatment for depression should be individualized and personalized. Okay, treatment improve quality of life, enhance functional capacity, improvement in medical health status, and it helps to lower the healthcare cost. Let me zoom into pharmacological intervention for now. All right, now we use antidepressant to treat depression. We most of the time, especially in the elderly population, we start low and go slow, but we must reach the adequate dosage of antidepressant, okay, to be effective. Now, how does medication or antidepressant help? It's by working on balancing the neurotransmitter, okay, for example, serotonin and dopamine, that has been not balanced, okay, in depression. Remember one of the biological factors that I mentioned just now, the causes of depression, okay, the imbalance between neurotransmitter. So antidepressant helps to balance up the neurotransmitter and therefore treat depression. Now, medication produce improvement within first week or two. Now, the effects is not immediate. All right, you need to remember after taking antidepressant, you may not feel significant improvement within the first few days. Most of the time you won't, all right? It takes about 1 to 2 weeks to see the effects, all right? Now, it helps to ease the symptoms of depression and return a person to a better level of functioning. Now, these are the issues that you need to look into, especially in the elderly age group. The patient's tolerability towards the antidepressant, okay, other polypharmacy that has been used, all right, to treat other comorbid medical illnesses. We need to look into interactions between the antidepressant given and also the other medications, all right, compliance to treatment. Now, it's not easy to ask an elderly people to take so many pills at one go, right? So try to minimize the usage of medication, okay? Now, the end organ physiological change will also affect the prescription of antidepressant. All right, how is the liver function? How's the kidney function of the patient? Now, psychological intervention is as important as medication treatment. All right, now people used to call it talk therapy. All right, so you talk to a therapist, all right, but this kind of talk therapy is it's not the same as what you do with your immediate family members or friends, all right? Okay, you will be able to learn, okay, extra skills, all right, from those professionals. Now, it is often used along with antidepressant. Example of specific psychological intervention that can be used, okay, to treat depression is cognitive behavioral therapy or interpersonal psychotherapy. Now, how can these psychological intervention help? It helps a person to first understand, accept, and feel better about yourself, okay, even though in those distress situation, all right? It also helps a person to recognize any possible thinking error that can happen, all right? Any automatic negative thoughts that comes out not under your control when you are in a depressed state, okay? Following that, you try to change behavior and the thinking pattern. All right, interpersonal psychotherapy helps you to improve on your interaction and communication between people, right? Which can be a cause of the depression. Professional help and treatment is helpful for all types of depression. All right. So if you or someone you know has symptom of depression, okay, do not stop there. Take action and seek help. Okay, begin treatment early. Okay, so those are everything about depression. All right. So now let's look into how we can be more empathetic and help those with depression. So, first thing, what can you do if you think you are depressed? Know that depression is not an illness and not a character weakness. So, you must know this first thing first, all right? So that you won't be reluctant to seek treatment and you won't hide. Okay, so depression can be treated. What treatment best and how long the depression lasts depends on the severity of the depression and also depends on how you respond to the treatment given, be it medication treatment or psychological treatment. All right. Now talk to someone you trust about your feelings. Okay, most people will feel better after talking to someone, okay, who cares about them. Right. Following that, seek professional help for a complete assessment and treatment if your depression is getting worse or is severe. Okay, like I said, your local healthcare worker or doctor is a good place to start. Now, remember that with the right help, you can get better. Now, what are the things that you can also do, okay, if you have depression? Is to keep up with the activities that you used to enjoy when you were well. So don't stop doing things that you are doing all the time, all right? Exercise regularly, all right? If you are not going for exercise regularly, try to do it, even if it's just a short walk, all right? Stick to regular eating and sleeping habits, all right? Stay connected, keep in touch with your friends and families, all right? They can be a source of comfort to you, all right? And sometimes even advices. Next, accept that you might have depression or you already have depression and adjust your expectations. All right, you may not be able to accomplish as much as you do usually when you are depressed or in depression. All right, so adjust your expectations. All right, avoid or restrict alcohol intake and refrain from using illicit drugs because they can worsen depression. They might make you feel relaxed initially, all right, but in long run, it can worsen depression. And sometimes you may develop addiction as well. Now, if you feel suicidal, contact someone for help immediately. Okay, contact anyone that you know, your family, your friends first as first line, all right, or call 911 or 999 for help. Okay, that's if you are depressed and what you can do. Okay, how about dealing with someone you know, okay, who are depressed? Okay, it is not easy. Okay, it can be very difficult to deal with someone with depression, all right, especially if that someone is someone that you love. Now, here are some tips on what you can do to help someone you know who is depressed while taking care of yourself at the same time, right? Support from carer, from friends and family facilitates recovery from depression. All right. Now, patience and perseverance is needed as recovery can take time. Okay, the first thing is be empathetic. Now, being empathetic is the most important demand or the need for someone who is in distress. Okay, it is not, I know how you feel. Okay, it is not feelings of sorrow or pity for others. It is actually your ability to perceive that someone is depressed, understand that someone experience and feelings accurately, and demonstrate that understanding back to the patient. Okay, so that's empathetic. It is an active process. It is more than just sympathy or feeling sorry for someone. Okay, how you can enhance empathy. Now, you can enhance empathy by the way we respond to what patient is telling us. Okay, someone you know having depression tells you that she's feeling very sad. Okay, there are certain events that make him or her feel very sad. So you nod, you don't interrupt. You reflect back to them by saying, I can see that made you very sad. Okay, validate that feelings of sadness. I can see how certain events would make you upset or sad. All right. So show the patient or the other person that we understand their perspective on the problem, right? By telling them, well, yeah, most people would likely feel that way, all right, because he or she feel that way at least, all right. So you don't have to have the same feelings as the patient. You don't have to agree with the patient's feelings to be empathetic. Okay, don't try to cheer up a depressed person because there are times it can feel minimizing. Okay, simply ask if there is anything you can help. Okay, the answer may often be no, many a times, but the support that you give will be felt. Okay, don't react with anger, even though your efforts to help may be resisted or rejected. All right, do it again and again if you can. Okay, offering help. Now, avoid critical or shaming statements. Right, don't argue about how bad things are or are not. All right, remember, it is not about you, it is always about them. So if they think it is bad, then it is bad. Okay, don't insist that depression or sadness is not warranted for their situation. All right, advocate for their recovery, convey hope. Emphasize that depression is very treatable and you are there to help. Now, when you think you have limits in helping them, encourage them to seek professional help when available. Okay, offer to accompany them to appointments. If they are very afraid to seek specialist care, bring them to see general practitioner at their normal family clinic. Okay, that's the first step. If medication is prescribed, help them to take it as prescribed, all right, compliant to the medication, all right. You yourself be patient, tell the patient to be patient. It will usually take a few weeks to feel better. Like I said before, it is not immediate in effect. Okay, not like painkiller or fever medication. Now, if you are living with them or if you are living nearby, help them with their everyday tasks. All right. If you are working with them, help them with their tasks at work. All right. To have regular, remind them to have regular eating and sleeping patterns. All right. Encourage regular exercise, social activities. Encourage them to stay positive. All right. Focus on the positive rather than the negatives. Now, in depression, many a times people get more and more depressed because they focus only on the negative. Okay, they have ignored the positive. All right, so helping them to bring their focus to the positive will improve recovery. Okay, now if they are thinking about self-harm or have already intentionally harmed themselves, do not leave them alone. Please closely supervise or monitor. If you can't, okay, if arrangement cannot be made for close supervision, please seek further help from the emergency services or a healthcare professional. In the meantime, remove items such as medication, sharp objects, or firearms that can be used to harm themselves. Lastly, take care of yourself too. Like I said, it is not easy to care for people who have depression or have emotional issues. So you yourself have to find ways to relax and continue to do things that you enjoy. Right? Remember, when you deal with a person with depression, you can help them recover, but you need to take care of yourself too. Okay, thank you. I think my presentation is short.
All right. Thank you so much, Dr. Tong. I think that was very, very insightful. And especially in an era where everybody is somewhat struggling post-pandemic. I think everybody has learned a thing or two from this talk. We do have a few very interesting questions that were given beforehand. So I'm gonna go ahead with the first one. So this person asked, how do we deal with ourselves when basic targets that are set, uh, but we still cannot achieve them, and therefore it makes us anxious? I think this, I highly suspect this comes from the student, because the example that he or she illustrated is that, like, for example, if you work really hard for an exam and you've revised everything that you're supposed to revise, and then in the end you get a bad result and you feel as though every effort is not up to par, or rather the result does not reflect the effort. So how do you overcome that kind of anxiety?
Okay, now let's see. Maybe I put it to this point. Focus on what you can do and things that is under your control. All right. Now, you have a major exam. All right. Now, what are the things that is under your control is your preparation to the exam. All right. Now, the outcome of the exam result, it's not under your control. All right. Okay. Because there are many factors like, especially if it's not, not subjective questions, like your clinical exams or ACs, all right? It has so much factors depending on the examiner's factors, okay? Now, so focus on what are the things that is under your control. Like I said, preparation. If you have done your best, okay, to prepare for the exam, all right, then you are good, okay? Now, if let's say you have done your best, you still did not get the results that you want. All right, so what can you do? Are you going to feel very stressed out? Are you going to go into depression? Well, again, focus on what are the things that you can do. All right, maybe, yes, you have tried your best, but you can think about, would it be okay or better if you change the strategy of preparation, the strategy of your revision? Okay, you can brainstorm it again with your peers or with your lecturers to come up with a better plan, better study plan in the future. Okay, so that's one thing. Second thing is, your expectation. Now, bad result. What is bad result for you may be different from a different person. Okay, maybe getting less than an A, it's really bad result to you. Okay, so expectation wise, I think you maybe can adjust a bit as well. Okay, if those expectations are too high. Okay, all right. Yeah, so that's it.
Right, so basically learn from your mistakes and manage your expectations.
Yeah, and focus on things that you can control.
Yes, I think that's very, very important, and that's very good advice. Um, Also, the next question is, do you recommend any specific diet for depressed individuals?
Okay. Specific diet, maybe not. All right. But of course, a healthy, balanced diet is good for anybody. Now, maybe I can put it this way. There are certain food or medication that can help to boost up serotonin level. Now, serotonin, it's one of the monoamines, okay, or neurochemicals that is involved in mood regulation, okay. So those antidepressant, okay, are medications that boost up serotonin, okay, in the treatment of depression. So example of food that is higher in the content of serotonin would be leafy green vegetables, all right. Fruits would be like banana, papaya, all right, or berries, cherries, all right. Those have high content of serotonin. Okay, nuts, walnuts, almonds are also high in serotonin level. Oats, all right. So in terms of choosing your diet, you can probably eat more of these, okay, if you can take it, all right.
So definitely no junk food.
Yeah,
It's just
no
gonna
junk
make it
food.
worse, right?
Even you and I, I have one.
All right,
Comfort
so
eating, actually, it's
yeah,
something that some people might use when they are depressed. So
right.
when people go for comfort eating, usually people eat fast food, people eat junk
Mm.
food. So don't do that. If you can, if you want to do comfort eating, all right, snack on papaya or banana.
That's true. It's as good. It tastes as good, I would say. All right. So we have a question here from the chat box. So this person would like to know how long could sadness last? Because I think drawing from personal experience, this person felt that there was a time where he or she felt terrible for 3 months straight, and while there were some elements of depression, such as no appetite, not being able to sleep, did not have any suicidal thoughts, but to this day, he's wondering whether or not it was depression or sadness. So it lasted 3 months and it had the elements of loss of appetite and trouble sleeping.
Okay, all right. Now, okay. Usually, if you have persistent sadness for more than 2 weeks, all right, you would want to think about depression. Okay. Now, if your sadness, if your persistent sadness lasts for 3 months, all right, I think you should go for a formal assessment, all right, especially if you do have some other symptoms like not being able to sleep, no appetite, all right. Okay. Now, how long could depression last? It can last very long. Okay. It can be even for a few years if you do not take any action. All right. So by taking action, okay, depression can recover very fast as well. All right. I have patients who recover from depression in 2, 3 months after seeking treatment. All right. The treatment doesn't necessarily mean medication. All right. It can mean psychological intervention, just any kind of treatment or help.
Right, because there are certain people who are intimidated when they know that when they feel as though depression must be treated via medication, not necessarily, right, Dr. Tong? Yeah, it can be via
Psychological
consultancy, yeah,
intervention. Yeah.
psychological
True, true, true.
intervention. So yeah, sometimes talking it out helps a lot. And
Seeing your counselors in university or schools can be
right,
your first line. Yeah. You do not
yes,
want to go straight to clinics or hospital.
that's true. That's right. So yeah, always seek help, and help is always readily available around you. But the first move has to come from you, right? So we have another question here. I think this is directed to how you handle yourself personally, because the question goes, how do you relax yourself while you meet so many patients who are depressed?
Ah, oh, it's nice. You are actually asking about me.
Yes.
Okay, all right. Well, first of all, I think for me as a professional in this field, right, I work a lot on boundary setting. Lah. All right. So I do not mix up my personal life, all right, with my work life lah. So this work life balance, okay, I manage my work life balance, all right. Whenever I know and whenever I feel that I am a little bit stressed, I stop. I stop for a while. I focus on relaxation. Now, when you are able to balance relaxation and stress, okay, then you will be able to take care of your mental health well. Okay. Now, not everybody can identify increasing level of stress easily. So you must be mindful in monitoring your stress level. Okay, identify when your stress level is climbing up. You need to put a stop. Okay, you take a rest, take a short break. Okay, do deep breathing exercise. Breathing exercise is good. All right, talk to someone. Okay, so those are the things that you can do when you feel stressed, and it helps you to relax. All right.
Yeah, I think it's very, very important to, in helping others, to help yourself as well, because there is no point in addressing other people's problems if you yourself do not feel relaxed, if you yourself do not have a good, you're not mindful of your own mental health and needs, right? All right. Fantastic. We have a lot of questions here. Dr. Tan, I hope you don't mind. I think we have a few more.
Okay.
This one is, I think, regarding stage fright. So, how do you overcome anxiety during presentations, which sometimes lead to clamming up completely? So, how do you overcome this?
Okay. Um. Okay. Now, when you get stage fright, Okay, it means you are already at the peak of a bell curve, correct or not? Okay, so before your anxiety reach the peak, okay, you have to do something already. Now, for someone who is, a bit anxious or afraid of going up on stage, okay, to present, okay, now you have to prepare yourself even prior to the presentation itself. Okay, I think make sure your baseline emotions are calm first, even before the presentation. Okay, so maybe right in the morning itself, all right, maybe the night before, make sure you have good sleep, all right, have positive thoughts. Okay, don't focus on the negative thoughts. Okay, don't think about, oh, what if I made this mistake, what if I presented the wrong thing. All right, so don't focus on the negative. Okay, start to just focus on the positive, have positive thoughts even the night before. All right, take a good rest, don't sleep late to prepare for the presentation. All right, sleep early instead. All right, okay, and then in the morning, okay, do your normal routine. All right, nothing extra, or maybe a little bit of extra. You can put on your makeup or things like that. All right, okay, but not too extra. Okay, don't no, don't omit your routine as well. All right, just as usual. Okay, so it helps to maintain your baseline emotions to be calm. Now, if you don't do that, okay, you start the day with an anxious emotions already, then of course it can escalate fast when you are on stage presenting. Okay, now that's before. Now, if you are on stage, you start to get anxious, all right? Okay, so again, you can try to relax yourself, okay, by breathing. You can, practice or do some breathing exercise even though you are presenting, you see. Okay, take short pause in between, all right? Just calm down yourself, all right? Ah, that's my advice for those who, get anxious or stage fright.
Right. So, while we are on the topic of anxiety, so a participant here has asked, are anxiety and stress the same thing, or are they different?
I would say they are different. All right. Stress can be anything. One can get stressed with a lot of things. All right. Anxiety, especially anxiety disorder, is a disorder. Okay, it can be very specific. All right, and usually a disorder, okay, anxiety disorder will affect your functioning, your basic functioning, your social functioning, your occupational functioning. Now, stress, it's different. Okay, stress can be positive stress, can be negative stress. Okay, and if you can manage your stress well, then it won't affect your functioning. Okay, so I think they are different. Stress and anxiety are different.
Right. So stress is basically something that you can face on a daily basis, but still be able to overcome. Whereas anxiety could be a disorder that needs more medical attention, would you say?
Yep, but there are times whereby unmanageable stress can affect your functioning as well.
Right. Yeah.
Many a times, if those stress are unmanageable, it will start to develop mental illnesses or mental disorders like anxiety or depression.
Right.
So it depends on how you look into it.
Right. Okay. All right. Okay. There's one more question. I think, but I don't think this is the last one. But
Okay.
this person is asking whether there are any differences between female and male brain when it comes to handling depression. Whether the female hormones actually affect females worse or better in terms of handling depression.
I see. Okay. Hmm. Is it a male or a female who asked this question?
And left anonymous, I think.
All
So
right. Okay.
yeah.
Now, brain. Okay, a depressed brain is different from the brain of someone who is not depressed. Yes, it is different. Now, there are scans that can prove that, all right? So, but however, whether a female or a male depressed brain is it different or not, I think there are no evidence to show that it is different. Okay? All right, now as for whether female sex hormones, well, hormonal imbalance, okay, can lead to mood fluctuations, lah, I would say. All right, so for example, those female sex hormones like estrogen or progesterone, okay, they do play a role in the onset and development of mental illnesses like depression or anxiety. Yes. So any imbalances can lead to mental illnesses or disorders.
Okay. So yeah, we can't help it because hormones are part of the chemicals in our body. So I feel as though they do have a certain impact when it comes to our mental functioning. Thank you so much, Dr. Tong, for all the insights that you have shared with us. I'm sure that they are very, very valuable to all our listeners today. I've definitely learned a thing or two. So we hope to see everybody again in series and webinars like this so that we can continue to share knowledge and be more mindful of our mental health. Thank you so much, everyone. Thank you, Dr. Tong.
Thank you, Dr. Nadia. Thank you,
Thank you.
everyone. See you.
Thanks to the organizers as well. Thank you. Bye.